Counseling approaches emphasize broad theoretical frameworks, whereas counseling modalities offer specific protocols and certifications. Let's look a little closer at the two. First, we'll start with counseling approaches. The focus on counseling approaches is overarching theories and principles that guide the therapeutic process. They provide a framework for understanding human behavior, emotions, and relationships, but they allow flexibility in implementing techniques based on individual client needs. Some examples of counseling approaches are psychodynamic therapy, humanistic person-centered therapy, and existential therapy. Some of the distinctive characteristics of counseling approaches are how flexible they are. Therapists are able to adapt interventions based on the unique needs and goals of each client. Their emphasis on relationship. The therapeutic alliance and rapport between therapist and client play a crucial role in the effectiveness of the approach. And their broad application. These approaches can be applied to a wide range of mental health issues and populations. Their focus on understanding, knowing that with these approaches, therapists prioritize understanding the underlying factors that are contributing to the client's difficulties. On the other hand, modalities offer structured, manualized protocols with specific techniques and interventions. Oftentimes, therapists must undergo specialized training and certification to deliver these interventions effectively. Some examples of modalities like this include DBT, dialectical behavior therapy, EMDR, trauma-focused cognitive behavioral therapy, and emotionally focused therapy. Counseling modalities are structured, and these interventions are standardized. They follow specific protocols that are outlined in training manuals or provide guidelines. They are also targeted. Each modality typically addresses specific issues or populations, such as trauma, addiction, or couples therapy. Once again, they often require certification. Therapists undergo specialized training and sometimes certification in order to ensure the competency in delivering the modality. And for the most part, they are evidence-based. Many of these modalities have a substantial body of research supporting their effectiveness for particular issues. To sum up the difference between approaches and modalities, think of it this way: flexibility versus structure. Broad theoretical approaches offer flexibility in adapting interventions to individual client needs, while specific modalities provide structured protocols for targeted issues. Certification versus general training and understanding. Therapists specializing in specific modalities typically obtain certification through formal training programs, whereas those utilizing broad approaches may have general training in counseling or psychotherapy. While both types of approaches can address various mental health concerns and have modalities with specific protocols, they often have a more defined scope of application based on their focus area, for example, trauma, addiction, or relationship issues.